Good afternoon, everybody, and thank you for joining us for the June Choosing Wisely Learning Network webinar. This month, we'll be hearing about how to engage patients in overuse and the Choosing Wisely campaign. Before we begin, I'd like to just cover a few logistics. This meeting is being recorded, and we will share it tomorrow on Workplace. While our presenters are speaking, we will have the lines muted to reduce unnecessary noise. But we do think your voice is very important. So while they are speaking, I do invite you to use the chat box. And we will unmute the lines at the end of the presentations for questions and comments. I'd like to introduce our moderator for today, Dr. Lisa Letourneau. She's working with the Foundation as the physician consultant for the Learning Network. Many of you may know Dr. Letourneau as the former executive director for Maine Quality Counts. And in addition to her strong background in quality improvement, Dr. Letourneau is also an emergency medicine physician. And we're very pleased to have her join the ABAMF team. And I'll turn it over to her to moderate today's conversation.
Great. Well, thank you so much, Kelly, and thanks everybody for joining today. We're really pleased to have so many folks on the call today and two terrific speakers. We are going to be having brief or somewhat short presentations from both Kellie Slate Vitcavage and Laura Morris from Connecticut, both talking about some very practical and interesting projects that they've done to implement Choosing Wisely in practice. So we're going to start with Kellie Vitcavage. We'll go for about 15 to 20 minutes and then go to Laura, and we'll just ask you to jot down your questions either through the chat or you could state them when we're done both presentations, but we'd love to have questions and discussion after both Kellie and Laura are through their session. So with that, let me turn to Kellie Slate Vitcavage. I've had the pleasure of knowing Kellie for, gosh, I don't know, Kellie, we're going to embarrass ourselves both, decades of different kinds of work in Maine and working previously together at Maine Quality Counts. We're very fortunate to have Kellie's background and expertise, and Kellie brings a lot to the table on this. She's implemented several rounds of initiatives around Choosing Wisely, including working with the clinical community providers as well as communities to implement Choosing Wisely in several specific communities, working with both clinical and community partners, and then most recently working on some of these cost of care conversations as well. So Kellie's currently the project manager for consumer and community engagement at Maine Quality Counts, and we very much appreciate having her share her learnings with us. Kellie.
Well, thank you, Lisa. That was very kind of you to give me that big introduction. I want to say that it's really all the people out there that I work with that are getting the job done. I'm just their little motivator, their cheerleader. Today I'm going to concentrate the short amount of time I have on using Choosing Wisely tools to empower patients. And I have some examples of what we've started out with in the clinical visit. But just to kind of wrap a foundation around this, we really look at beginning to frame the Choosing Wisely message in a certain way because of the patient-centric side of this, that patients want communication with their clinician, participation in making care decisions, they want access to information, and really they want to focus on safety when justified, and that communication in plain language, all of which Choosing Wisely helps provide that. Choosing Wisely really is a way to bring in the patient into the discussion in a way that they can understand, and it also provides that evidence-based medicine from the different specialty groups as well on the clinical side. And so that information is accessible to everyone. I don't think I have on this slide presentation the new Choosing Wisely app that can be accessible for iPhone as well as Android. So I would definitely check that out if you can. We also, with our work, as we're a practice transformation network for Maine, New Hampshire, and Vermont, we look at ways we can connect Choosing Wisely to value-based care and payment. And so we look at framing Choosing Wisely with our systems we're working with, that it's linked, especially in the way that patients can spend less money to achieve better health, providers achieve efficiencies and greater patient satisfaction, patients become healthier while reducing overall healthcare spending, and it's linked to the quality payment program. MIPS, improvement initiatives, if you know what some of those are, and a couple of them are use of evidence-based decision aids to support shared decision-making, and also the engagement of patients, family, and caregivers in developing a plan, And there are others that various primary care, behavioral health, or specialty groups can take a look at to see what may meet their needs as they're looking at MIPS. So let's get right into, we started out back in, I think it was 2015 or earlier, actually 2013. We started looking at piloting Choosing Wisely and integrating it into the workflow. And so back early on, it wasn't something that was a thought process clinically, and so we had to visually kind of draw out different scenarios with our pilot practices we worked with to figure out how we can visualize how this might work, visualize what the touch points were for Choosing Wisely to be included throughout the practice team daily workflow. And so we came up with a toolkit. It's extremely basic. It just gives you scenarios that you could take a look at, but look at your own environment, your own culture, and talk to your leadership and your practice team as to what might work in your culture. All of our practices kind of implemented it in different ways and utilized different members of the team in a different fashion. So just kind of put that hat on as you see some of the example scenarios that we have. So on this slide that you see here, it was an initial workflow that is in our current initial implementation toolkit. And it was also to help them visualize how they could incorporate. And we really started out with just using the 5 questions. How can we look at providing visuals as well as integrating the team to make the 5 questions visible to patients? And so you've got your PSR, you have your MA or your nurse educator, you have the provider explaining the patient education piece of material. You can see that in the last picture on this slide, that the visuals for patients, as we know and are learning more about, are extremely valuable for activating patients and engaging the patients in their care. And so we went further. Everyone had a different style. So this is a different style of a workflow, looking at bringing in the conversations that were sample conversations using the practice team. So you can see that the PSR has a sample script. The MA or nurse educator, upon rooming the patient, has a certain script, as well as the provider. And so it's really getting at that. How do we ease into a typical conversation about working with the patient? We know that you often have many questions for your provider during your visit. So we really want you to read through these 5 questions as you're waiting and maybe kind of draw up your priority questions that you may have. So it's just that conversation starter. And then the MA can also prompt when rooming the patient. And so it's just everyone is changing the culture of, we really want questions, we desire those, we want you to become more activated, and we encourage you to ask questions. On this slide, which is a little maybe hard to see, it is a little hard for me, we went into diving deeper into question number 5, how much does it cost? This is our cost of care work. You can see it. We have an online module if you're interested. There's a link on the screen here that you can see that. And we base this on the 4E model of communication. And the 4 E's are engaging the patient, empathizing with the patient, educating with the patient, and also engaging the patient. And so it was very helpful for us to use that framework. We had some trainings involved in all of this, as well as working with the practice teams on suggested ways in which they can begin a conversation about cost. It's tepid water we're stepping into and dealing with the cost question. What if we don't have the right tools? Where do we send the patient? And so we started out with sample scripting, looking at a trigger question, working with the entire practice team to introduce this concept. We created a nudging poster that talks about, are you concerned about the cost of your treatment today? That was a fairly large poster that would be in the waiting area. So patients begin to feel what the culture is of the practice even before their clinical visit starts. So it's really helpful to have some visual prompts. Also on the Choosing Wisely slide, the 5 questions, we had some of our practices putting in 3-foot by 5-foot Klingon posters in their waiting area and on the back of every door in the exam room to just help create that conversation starter, the environment and what we're looking at. And so I won't go through this tool here because of the timing we have here, but I'm happy to answer any questions and really would direct you to the online module and that you can skip through. It's a free module and you can maneuver through it as you wish to get to the information you'd like. And so we did this with dealing with reducing advanced imaging for low back pain, which this can be changed up to meet any test procedure and looking at alternative treatments. So that, and patient education on that issue in regards to cost. We also, the value of the patient educational materials is beyond what we all believe clinically. This information is so helpful for not only the patient, but if they have caregivers or families, because then they can go home and have a conversation. It sets the stage for that patient to begin to become much more engaged in their care and activated and have a better understanding if what are my alternatives, what else could I do, how can I look at the cost factor, are there people on the staff or the system that I can talk to about the cost factor as you work around the shared decision as to what would be the way of treatment for that patient. So it sets you up for a much deeper conversation, and it helps the patient feel more comfortable and become much more activated in their care and more satisfied in their care. So you can just see some of the patient education materials that are available. There's over 250 patient ed materials as that you can go look at on choosingwisely.org. And then, let's see, I just want to kind of show you, we added on to some of the patient education materials that strictly deal with the cost, and there you can see on the left-hand side the nudging poster that I talked about. And it's just so helpful to be able to walk in and see that, wow, you know, this, even though the clinic has always probably felt they care about the cost, you're actually seeing something visually. And it's really incredible with the response with the patients that we worked with, the importance of that. So then our practices really said, can we have a wallet card? Can you design a wallet card for us so that our patients can, based upon our own information and what we have here at our setting, they can actually talk to a staff member, and here's their phone number, so that they became very transparent in helping patients access people on staff who can assist them. The other side is to continuously help patients understand where they can go to find out more information on cost. And we also have a public cost website that we promote as well, that they can go in and look at around 200 different procedures to start getting an idea and educating themselves on what's available for them. So really with our pilot work, we really have found out through the feedback and that it's, you know, let's make it easy for the practice team. We all know there are so many QI projects going on that we're trying to add this as what they're already doing so that it's not another thing they can do, and just, you know, looking at posting the Choosing Wisely materials where both staff and patients can see to help remind everyone that, oh, yes, this is our culture, we want this, we encourage it. You can look at some of our practices wanted a file folder because they couldn't get it into their EHR yet, the patient materials that they felt were ones that were always coming in, whether it's low back pain or headache or something that they could easily pull out of that folder in the actual exam room. The 5 questions handed out at check-in, looking at those 2-page patient education sheets, and ensuring that there's a plan for providers and staff to have information to address question number 5, how much does it cost? And we really work with the practice teams and have found that the provider just needs to set the stage. They don't have to know what the costs are or where to tell them to go. It's just setting the stage so that they have a system in place as to who can really drill down and talk with the patient, whether that be with a nurse educator or someone in another department. These are the visuals. I always like to make it real for what's happening in practices. We've had some of our practices utilize their patient and family advisors, which is great. You'll see some things that they design for exam rooms. You can see the 3-foot by 5-foot poster in a waiting area. You can see the file folder I alluded to there. It's just really whatever culture you have in your practice and your system, it's what you're going to adopt. We also have Choosing Wisely on some of our specialty groups' website portals so that the patient can have direct access to the link to learn more about Choosing Wisely and the 5 questions. And this particular specialty practice really put it right front and center. Patients could not miss it upon walking into the waiting room and checking in. Just gives you some ideas for visuals. These are some of the best practices. I think that, as we all know with QI projects, looking at engaging the entire practice team early with some team-based education and looking at the groups involved with you that you tend to refer out to, that they're informed and are working with you along, at least on the educational level, and understand the evidence-based guidelines. Focusing on that patient education, it doesn't have to take extra time. It's just how you want to implement that into your already current system. And also, if there are patient and family advisory councils, they're so creative. They're really great, and they're a wonderful volunteer support group to help move things forward without the cost to the practice. The visuals, of course, we also have some practices using closed caption with no sound of some of the Choosing Wisely videos on the TV monitors if they have them, so we make those available. And then also I said to have a plan of how to address the cost question. And some of our practices, the larger systems, are able to print out the patient information sheets for the patient. They're not in color. We understand the limitations behind that, but just to be able to provide them is a great step forward. And then use your data. If you want to look at quality improvement activity you're already doing, how can you incorporate Choosing Wisely into that, and then begin to track your data if you want to reduce the antibiotic prescriptions, tracking that and figuring out what patient education materials, Choosing Wisely, and wrap everything around that, and then you can track baseline to, out 12 months to see how you're doing and working with your patients on that. It's a great tool. And some of the lessons learned, and this wasn't me, these are our clinicians talking. They felt that engaging patients in decision-making did not extend their office visit duration. It made it smarter and more succinct and concise so they could really get into more depth of conversation with the patient. If properly executed, can save time by callbacks, patient follow-up questions so they didn't understand, what they were supposed to do upon leaving or what's happening next week. And also, obviously, we all know the team-based model worked best for many of the practices. And then we started with small pilots, like look at 1 or 2 or 3 different areas you wanted to reduce the use of antibiotics, reduce advanced imaging for low back pain, and reduce the use of benzodiazepines were the ones we tended to focus on in the beginning. And I wanted to include a slide for resources at your leisure. Take a look at them. I'm obviously available as well as Kellie Rand can answer questions. So can Lisa Letourneau. We've all been involved with Choosing Wisely since its inception, and there's quite a bit of information out there. It's just tweaking it and helping you maneuver through how you would like to integrate this into your clinical system. So I just wanted to give you that high-level view, and I'm hoping that you have questions you want to ask, and between all of us on the line today, I think we can try and drill down and assist you and gain additional information to make this time that you're on with us today very worthwhile. So thank you.
Great. Well, thank you, Kellie, and clearly a tremendous amount of work that's been done. So again, I want to encourage people to either chat your questions or hold on to them, and we'll bring the questions forward after we have a chance to hear from both of our presenters. So next, we have Laura Morris. Laura serves as the manager at the Office of Health Strategy within the state of Connecticut. She spent the past 10 years working as an advocate for the state of Connecticut and has been an active member of the statewide Connecticut Choosing Wisely Collaborative. She's also trained as a patient champion with Consumer Reports and has done a lot of work advocating for patients in her various roles. So we're going to be hearing about some of the work of the Connecticut Choosing Wisely Collaborative. And Laura, if you're ready, we'll pass the baton to you.
Okay, great. Thank you. Can you hear me?
We can.
Okay. So thank you for having me. I'm happy to present what we're doing here in Connecticut with Choosing Wisely. And these are just some of our partner organizations that we're all collaborating with and together, sort of a broad and diverse group. And our Choosing Wisely Collaborative really focuses on 4 domains: consumers and communities, the delivery system, purchasers and policymakers, and education of healthcare professionals. And our collaborative really is to raise awareness, be a catalyst, and create the avenues to provide the support. And these are just some of the pictures from our different events and outreaches. The one down to the right bottom hand corner is of Jackie Murillo. She's a nurse consultant with the Office of the Healthcare Advocate, and she is also was a patient activist with Consumer Reports, and she's actually was doing a roundtable discussion there in that picture. And I'll talk about that in a couple of minutes, about the roundtable discussions that Jackie and I conducted throughout Connecticut. But first I wanted to talk about health equity and choosing wisely. We started this, actually it was Nancy Yedlin, who is the Vice President of the Donahue Medical Research Foundation, who spearheaded this pilot project, working in different FQHCs, I think it was one, maybe two, to get some feedback regarding choosing wisely and the 5 questions. So that was 2015, 2016, and we're now taking that and leveraging choosing wisely as a tool to achieve health equity. And in October of last year, we conducted a call to action summit where we invited multiple partners and stakeholders throughout the state. This slide talks a bit about the pilot project that Nancy Yedlin conducted. It was point-of-care pilots at 2 federally qualified health centers in Connecticut. In Connecticut, they conducted literature review, expert interviews. They had 4 focus groups. And what came out of that was our sort of vision to move forward the health equity aspect with choosing wisely. So in 2017, it was Nancy, who was amazing, conducted and convened this summit of local and national experts. We had presenters there. Most of them were providers who were utilizing choosing wisely in their practices and received a lot of information. We identified different ways that we can address different concerns, both from a consumer and patient perspective, also from practitioners and health systems, on how to have these conversations. What came out of that was a report with some insights and recommendations as part of this call to action summit. The participants were broken into smaller groups where we actually had some homework to complete in a short amount of time with some specific questions. And so we sort of took all that information and put that all together and came up with some insights and recommendations and maybe some action opportunities. This slide, it has who we believe should be the lead role and what the action opportunity should be. This is empowering consumers. One of the items that really came out of this was revising the 5 questions to be more open-ended, being able to modify them depending on the population or group that you're speaking with or you're trying to have use the questions. Feedback loops between our community health workers and clinicians, that was with our health systems, and supporting the community health workers, to use more culturally relevant messages and consider literacy and language of the target audiences. Did that. The next one is, I don't think that slide moved forward. Let me try that again. No? There we go. The next action, opportunities, was engaging the care team. Really what came out of this was providing technical assistance and educational modules to clinicians and practice leadership to help them implement the choosing wisely in their practices. Let's see, our health systems was embedding choosing wisely recommendations into programs and tools for clinicians that they use regularly, such as the electronic medical records. And actually one of our partners, one of our state collaborative members is the Office of the State Comptroller for the state of Connecticut, and they are actually utilizing some of the Choosing Wisely quality measures in their electronic health records for the state employee health plan to measure. So we're really excited to see how that's going, learn more about it. And we also, one of the other action opportunities was to engage regulators, payers, into the Choosing Wisely professional curricula, whether that's with nursing schools, clinician licensure requirements. And the next slide. So this is campaign marketing and materials. Again, the picture on the right side of the screen with that gentleman really talks about the 5 questions, and we had a lot of discussion about this around the 5 questions. Really, can we rephrase them to make them more open-ended so that patients and consumers are more comfortable asking those questions? It was a suggestion that we change the first question from, do I really need this test or procedure, to how will this test or procedure improve my health? And some other options. The last one was, you have the right to ask these questions. I get the feedback that was received was from folks, especially in some of our roundtable discussions, was, can I ask these questions? So we found that pretty interesting. So really looking at ways to, tailor the campaign and marketing materials in accordance with, the group or the population that we're trying to reach. So here's some of our next steps. We've done the first one. Connecticut has a yearly annual conference called the Better Health Conference, and actually we did have Kellie Rand was there, and she was a presenter along with Nancy Yedlin from the Donahue Medical Research Foundation, and Denise Smith from the Health Disparities Institute at the University of Connecticut, and they presented a breakout session on Choosing Wisely, which was excellent. We're also looking at ways to identify and reach out to other organizations to disseminate our information, perhaps post links about this content and about the report on using Choosing Wisely for health equity. Looking at redrafting the questions and marketing materials through the health equity lens. Hopefully convene some groups in Connecticut and react and distribute. We're trying to partner with local and national experts to develop and provide resources for teams, systems, community organizations, consumers, and patients. basically to just increase awareness and understanding at all the different levels. And align the efforts to promote choosing wisely with other Connecticut efforts to achieve optimal health for all residents, regardless of race, ethnicity, or socioeconomic status. And we have our agency, the Office of Health Strategy, is a brand new agency. It is taking existing units or departments or entities who are working on health and healthcare reform and really just putting it all under one umbrella to have a more uniformed, better approach to health reform and in Connecticut, and choosing wisely is part of that. Now, this is my contact information, but I wanted to just briefly touch upon the roundtable discussions that I conducted, as well as Jackie Murillo from the Office of the Healthcare Advocate. We went around Connecticut, gathering a group of usually about 10 to 25 people. It was to bring the materials and the Choosing Wisely materials to them, specifically looking at the 5 questions, asking them if they've ever felt that they, overused any type of medical treatment or prescription medication, so getting feedback from them. We asked them what they thought about the questions, and it was very interesting because Jackie conducted her roundtable discussions in Spanish in some of the inner cities, mostly the senior centers, and I conducted mine more in the suburban areas of Connecticut. And it was very interesting how we had very 2 different views and feedback. So for Jackie's groups, every single roundtable discussion, what came into that from the participants was the social determinants of health. So their food security or insecurity, when the doctor tells them they need to eat more fresh fruits and vegetables. And that actually all came out of this whole discussion, which was interesting: transportation, language barriers, as well as translation. They loved the cards. They couldn't wait to start using them. They, I think culturally believed that they didn't question their provider when they went for their visit, and they felt as though the card was a permission for them to ask the questions and really be a participant in their health and their health care and decision making. The groups that I had were very different. They were already felt they were actively participating. They felt that they basically asked every question of the 5 questions, with the exception of the cost. That seems to be the one that everyone agreed that they felt every time they asked the doctor, or if they were to ask the doctor, they wouldn't really know that and didn't feel that they would get a great answer on that. But so 2 very different, separate, and different types of information coming from those groups, which I, again, found very interesting. And so now what sort of has come from that is also, can we tailor these questions for these different populations and moving forward? So with that, I want to say thank you, and I guess I'm sending it back to Lisa for any questions.
Great. Well, thank you so much, Laura, and Kelly again. I see in the chat that Kellie Moran has been actively chatting in links to more information, to both some of the tools that Vitcavage referenced and that some of the activities that Laura referenced. Not seeing any actual questions yet, unless I'm missing that. But
Lisa,
yeah,
there is one question, if I can read it for you. It says, Kellie and Laura, did either of your Choosing Wisely programs include any partnerships with the local health insurance plans? If so, how do you suggest making the most of those partnerships? If not, what were some of the barriers to such a partnership? Thank you.
So this is Laura. Well, actually, as part of our Connecticut Choosing Wisely collaborative, we now have the Medicaid organization on the medical side as part of our collaboration. It's a community health network, which is amazing for us that they're now part of that. As far as any other insurance, I'm guessing commercial insurance, we have our state of Connecticut employee plan through the state comptroller's office that's part of it, our collaborative. But actual carriers, we don't, and that is one of our recommendations is to get them here and at the table.
Kellie, anything?
Yeah, let me.
Whoops, I think, Kellie, you might have just muted yourself accidentally.
I did, actually. Thank you. We really started working with one large employer, which is Bath Iron Works, and it's really where they were looking at their claims and diving into imaging, advanced imaging for low back pain. So we began to work with them. We began to work with our Maine State Employer Benefit group, who really wanted to help drive down the costs that they were seeing with state of Maine employees. Early on, we worked with Harvard Pilgrim. They were very welcoming to the information to send out to their customers and family members to help understand what Choosing Wisely was, how they could use it. So we were able to use it in that way, but not an actual formal agreement. So we worked through our health systems. In our last 3-year pilot, we worked with 3 health systems, 2 of which were hospitals, and 1 was a large federally qualified health system. And so through the work that they were involved with us, we had over 30 practice sites involved with us on the project. We were able to work with their marketing departments and really promote the messaging to the community, and then also work with the practice teams and the providers on the implementation. And in one particular case, the large federally qualified health center was able to move guidelines along for all providers on reducing the use of antibiotics, and that it really was an effective guideline that they now all follow to really reduce that, as well as providing patients with a take-home kit of what was called a flu and cold care kit. So they kind of utilized Choosing Wisely in different ways to meet the needs of the different populations that we were working with. The BIW was very informative to our work with diversifying the Choosing Wisely materials. What was originally on the patient education materials wasn't really conducive to their employee type, such as the guys working out in the yard building the boat. So we worked with Consumer Reports early on to begin to identify different images that really related to that workforce, and we're able to move several things through. They did digital video monitors outside that were very large for different ways of educating their employees. So there was a lot of different ways. We met with their medical staff at BIW. I think it was Lisa Letourneau, as a matter of fact, who may have done that. And we're able to move forward on some ground in the way of the clinical evidence-based information that was available. So it was a really nice opportunity to work with them, as well as with our 2 hospital systems who really move things along internally in that way.
I'll also just chime in on back to the payer question. I don't know if there's anybody happens to be on the call from Excellus Blue Cross Blue Shield in New York State, but I happen to out there to do a talk on Choosing Wisely recently and learned a lot about what they had done. They had actually used their claims information to identify 2 or 3 of the most high opportunity Choosing Wisely areas of focus, and then worked with their provider groups to try to focus on those. They also built in some incentives in their existing provider contracts for meeting certain Choosing Wisely targets. Their big, while those approaches were good, they felt it would have been even more helpful, or would be more helpful moving forward, to try to link into the priorities of the health systems. They work with a lot of, organized health systems, as most of us do these days, that had a set of their own priorities already in place under their various ACO initiatives. So they thought it might work even better to sort of start with what is the health system wanting to work on or focus, or maybe utilization goals to reach certain ACO targets, and then how could Choosing Wisely help them do that. So I think there's lots of opportunities. And maybe somebody from Excellus on the call. Is that Rafa? Mm-hmm. Rafa Asadi, are you trying to add? No?
No, I'm sorry.
Oh, okay. It looks like somebody was ready to speak. Sorry.
Okay. Just to move on, I do have a question that came to me privately in the chat, and it's, how do you measure your progress? For example, how did you measure inappropriate low back pain images? And Lisa, as a clinician, you might be able to answer that much more in-depthly than I can, but yes, we did measure. We ran data metrics from a baseline over the 3-year period of time, and looking at the evidence-based medicine for imaging, advanced imaging for low back pain, and used the ACP guidelines for that, and also, only with the red flags occurring. And so working within that guideline of Choosing Wisely by that specialty group, that's what they followed. And then we measured, I forget which NQF measure it was, 59 maybe, I could be wrong, but I'm thinking that's what it is. That was tracked and followed throughout the course of this 3-year pilot.
Yeah, so just to expand on that, so I believe that's actually now an established HEDIS measure, right, for low back pain specifically, and it tries to factor in those different, characteristics of looking for no imaging done within, before 6 weeks after diagnosis, identifying, exclusions for anything that would constitute a red flag. But I think the bottom line is, in a lot of these measures, you're not actually judging is each test done appropriately. You're looking for a change in the baseline of testing to a lower level, right? So you really can't go in, obviously, on each one and decide, did this particular decision or test follow the Choosing Wisely guidelines or not. So at least in that one, we do have an established HEDIS measure, but it's really looking for a change in the overall rate of testing. I see a related one for Laura. How are you measuring Choosing Wisely efforts in Connecticut to assess the impact of these initiatives?
So that's a good question. So our collaborative is more of a convener. Convene groups to get them to, utilize or start using or just know about the Choosing Wisely measures. We've met with several different hospitals, some employer groups. Some of them are already utilizing them in their ECQMs. So we don't really, since we're not utilizing them as a direct collaborative, as a sort of convener for the state. I'm not sure I can answer that. I mean, we track on who's actually, what health systems, what hospitals, what providers, what employers are using Choosing Wisely. And it's interesting, every now and then we always hear about somebody new we didn't know about. And so for us, it's really providing technical assistance for them to utilize the Choosing Wisely.
Great. So I'm seeing a couple others, one related to the measurement and then another back for Kellie. So from Nikia, we completely agree with you on the importance of looking at trend. Does that message resonate well with providers, or do you find providers wanting to go case by case to look at appropriateness? So Kellie, Vitcavage, you probably had the most experience giving that feedback back to providers in terms of looking at changes in trend of the various measures that you were focused on, particularly in that recent community-based effort. Do you want to talk about that?
Sure. It was very interesting and evolved over the time. At the very beginning of this 3-year grant, our 3 health systems, we met and talked about, where we were heading, where we were at, and we looked at the data, and it was all blinded between the 3 of them. And so that was fine, whatever they wanted to do. At least they knew what they had, and we talk about, what best practices, strategies, challenges. And then as we move further down through the 1.5-year mark, they were starting to be curious about how did they compare against the other 2 health systems and their rates. And so they then decided to unblind their data, and we would talk about it as a group. And so that, to me, was a huge step after they trusted the source of the data coming out of their own EMRs, working with their own staff. We coordinated and gathered that data, didn't change that at all. Obviously, they would always receive a copy of it before we submitted it to ABIM Foundation. And what they then did with that, once they felt comfortable and trusted the conversations and the data, brought them to greater depths within their own systems. The one system I was referring to earlier was looking at once they saw the other 2 systems' rates with antibiotic prescribing and where they were and compared to where they were, it created an aha moment. It was like they wanted to take that back and figure out why their rate was higher than their 2 other systems they're working with. And so they decided to drill down at the system level, looking at all of their providers, coordinating the effort so that they had conversation with outliers on a more personal, private level, and then being able to implement a policy on when you can prescribe an antibiotic and what the coding looked like and that type of thing. So they actually implemented that across system-wide once they felt comfortable and were able to drill down and have conversations with their providers and their quality improvement teams and looking at the metrics. So it was a gradual approach. It's not something that you can just leap into. It really needs to come from within the groups working with the data to begin to analyze that and compare it against what they're looking at internally, and especially if it's something they're currently working on as a priority. I think now with Maine, we transitioned into the opioid prescribing and working with the different meds, and so there became a keen interest in tracking data, of which it's an extreme priority, I think, for all of us across the country, but it was very much a priority here in Maine. So you can also look at working with data sets that are really particularly a priority in your community. I hope that helps answer that a little bit.
And I'll just chime in behind that, Kellie, back to the specific question about did they accept sort of trend data, or did they want to go case by case and say, yeah, but that one was really right or wrong? I think they accepted trend data. They were used to trend data in their own system, so it was something they were familiar with and appreciated. So trending was particularly of interest. We would then study, okay, what time of year was this? So you could begin to understand if you had an increase. Well, it could have been super cold and flu season. So we strategically looked at ways to help educate patients that you don't have to have an antibiotic if you have these symptoms. And so it became ways of changing the conversation and changing strategies and tactics at the clinical and marketing level of the hospital system, so to speak, as one example. So, yeah, trending was great. They really appreciated it. Great. Okay. And we had a question from Bill a few minutes ago. Did either of you use the Choosing Wisely Patient Champion Activist small group conversation model? Or does anybody need a refresher from Bill about what that is?
Thank you, Bill, for asking. Yes, we did. We incorporated feedback from our champions. I wish it could have lasted longer as an initiative. We do incorporate conversations back and forth as we move forward with our practice transformation network work, so it was very valuable feedback and incredibly important for keeping things patient-centered.
you want to say a little bit more? Oh, there's Kellie, beat me to the punch. So link to the model. But do you want us to say a word or two, Bill or Kellie, about the small group conversation model?
Yeah, maybe Bill wants to bring it up. I would appreciate that.
Bill, can you unmute?
Can you hear me?
Yes.
Yes. Great.
Oh, hey, very cool. Well, the small group conversation model was based on some work that we did with as baby boomers for balanced healthcare, and it was adapted by Consumer Reports for the Patient Champion Activist program that, as you said, was short-lived, but I think that it did some important work using that small group conversation around the country to engage our friends and neighbors, really, in conversations asking the question, are we overdosing on health care? And it incorporated the Choosing Wisely materials into the heart of that conversation. I don't know what else you'd like me to say about that. That's in a nutshell.
Yeah. No, that's great, Bill. We appreciate that. And I wish as we move forward into the community work, we really need more of that to really bring in the consumer side, the patient side into this to further engage people and to be more activated in their care as to what they may not need as part of their health care. Great. Thank you.
Super. And then back to the provider side for Kellie, how widespread is the adoption of Choosing Wisely by providers in Maine?
How widespread, and help me out, Lisa, we have, when I was adding up how many different systems we've touched personally that I know of, we have 14 different systems, whether that be smaller systems, larger systems. And so I wanted to be able to slightly touch upon that. There's interest with leadership groups strategically with hospital systems of how they can incorporate this as not only a shared decision-making opportunity, but patient-centered opportunity. It's becoming one of our key foundational factors for our practice transformation work to achieve certain metrics and outcomes, and also ensuring patient satisfaction, looking at medication management, whether that be also with health literacy and patient activation, shared decision-making, garnering the voice of the patient in governance. We use Choosing Wisely as the foundation for all of that. And we're trying to incorporate that and spread that throughout 3 state areas that we're involved with PTN. And I don't have a specific number for you. I wasn't actually prepared for that, but I can certainly find that and provide that for additional information.
Yeah, and I would say, we were very fortunate at Maine Quality Counts to be a grantee of ABIMF and Robert Wood Johnson since the first round of Choosing Wisely efforts. And I want to say, way back then, Kellie, we did a baseline survey. Granted, it was a convenient sample, I think, through the medical association, but we had a pretty high level of awareness relatively early into this. I want to say on the order of 40 to 50% of physicians or clinicians who answered expressed,
absolutely
with Choosing Wisely. And I think the real key is how many are actually using it in practice, and I think that depends more on the system's commitment that their employer, their medical group, or their health system's commitment to actually embedding the process and some of the tools, in the daily flow of the practice. So,
right. Thank you for bringing that up, because I was just thinking implementation of actually what I knew. But you're absolutely right. That interest was very high, peaked at that time. And we do a lot of presentations with a lot of different clinical groups, and anymore you have a majority of the hands raised to say they know about Choosing Wisely. They may not be using it on a daily basis, but they're totally aware of it, the results around the country, and that kind of thing. So the conversation has really gotten to a large majority level.
Mm-hmm. Great. I'm also seeing a comment from Anikia. Thank you for the helpful webinar. My team works with Excelis to measure Choosing Wisely related services from claims data. Can read more about it's the Milliman Health Waste Calculator with a link there to a PDF. We're also hoping to get folks from Washington State, the Choosing Wisely Alliance there, to talk about their use of the waste calculator in a statewide report that they did showing up, shouldn't be surprising anymore, but still a surprising level of use of wasteful use of services in that state, separated by county or region. So thank you, Anikia, for bringing that up, and we're hoping to have more discussion about that in a webinar this fall. So with that, we're getting a little close to the end of the hour. One more here from Kelly. Has any alert tracking data been used in the outcome or measure data, or was it only based on ordering data? Has any alert tracking data been used in the outcome or measure data, or was it only based on ordering data?
I'd have to have more of an explanation about what to do by alert. When I'm thinking alert, I think of the EHR, and if an alert comes up, it flags to the provider, wait, do you have this, do you have this, do you have this before you order this? Is that what is meant by that?
Yes,
Kelly,
yeah,
Oh, please.
yes, that's what I mean by that.
We don't, but I know that there's other systems that Kelly ran that perhaps they could showcase that in our work. Larger systems would have alerts in their EHR that they implemented. So I'm hoping that Kelly Rand could perhaps send you in the right direction as to who to talk to with some of the larger systems that I know have put some alerts in. Kelly Rand, I think Dr. Barbanal was one of those who talks about the alerts.
Yeah, we had a number of organizations who use the best practice alerts as part of a larger intervention system. No one used them as intervention on its own,
Right.
but Henry Ford was one of the groups that used it. And I could probably, if you want to email me after this, I'd be happy to connect you to some of the people who did that if you want to learn more.
Great.
Thanks.
Thanks, Kelly.
Great. Okay. So with that, actually, we're right at the end of the hour. So I would just, I guess, thank all of you again. If you have additional questions, feel free to email or chat Kelly Rand or myself, and we can sort of pass those on, get answers back from our presenters. We are looking forward to continuing this learning session series, this learning network series with monthly webinars. Kelly Rand, do you want to chime in with anything else in closing?
Yeah, I just want to say thank you to you and both the speakers. And I want to let everybody know that if you are on Workplace, we'll be posting the recording and the featured resources. And if you're not on Workplace yet, we're hoping to, we're doing it in phases, and we'll be sending out more invitations, and we hope to get you on soon. So thank you all for coming today.
Thank you all. Thank you, Kelly. Thank you, Lisa. Thank you, Laura.
Thank you.
Kelly and Laura. Okay, take care. Bye-bye.
Bye.